Black mothers and babies are dying at higher rates than other ethnic groups. And not only are there deaths, but there's also the morbidity. So poor outcomes after birth, the near-death situations.
We know that Black women in America are 3 to 4 times more likely to die in relation to pregnancy and childbirth than anyone else, and it is completely avoidable. And when you look at it, you realize that it's not a function of this woman's educational level. It's not a function of this woman's socioeconomic level. When you look at the issue, and you don't have to scratch the surface deep enough to figure out really quickly, it is literally because of her race and because of the implicit bias that is in the medical health professions.
When we bring clients and we're joining and accompanying clients to the hospital, we need there to be culturally competent providers that are actually serving them, so that all the work and the efforts that we're doing to keep moms calm and to support the family and to come back home with them and make sure that people are all tucked in and nursing, that the system is actually going to support them when they get into the medical world.
Recognizing this is about implicit bias, I decided to do something about it. And so we wrote a bill that acknowledges the fact of implicit bias and then seeks to address it by specifically requiring that medical schools, nursing schools teach these soon-to-be professionals about their bias.
And if we want systems to change, there has to be funding to back up those things. So I believe that it's imperative that this bill is supported, not just for the policy to be implemented, but for our moms' lives to be saved.